Assalamu alaikum doctors. In this video I am discussing a recall communications. This communication task is that talk to Amani. She is a 13-year-old girl. Okay. She is a known case of epilepsy on lamotrigine for 1 year. She is following up with the nerve doctor and she has done the drug level 1 month ago, which was normal. 2 days ago developed gastroenteritis and GP prescribed for her metoclopramide for vomiting and developed oculogyric crisis. What is oculogyric crisis? Look the picture. That is abnormal deviation of the eye, abnormal speech pattern and abnormal contraction in the leg. And then the family called the ambulance, hospital, and doctor give the antidote procyclidine. Resolve talk to her about that. So this is the oculogyric crisis communications. How can we do that? The spikes are introduced, tell the result. That is first introduce, empathize, then feeds, listen, talk less. Explain rescue therapy with Bakkal metazolam. If prolonged seizure reassure, patient leaflets, investigation, meeting with consultant, multidisciplinary management, reassure, arrange further meeting, answer queries about the causes, and if not able to say, would like to get back, speak to the consultant. Okay. So as usual, IRCAP is a teenager girl, so it's really an honor to sit with a lovely girl like you. You are really smart, what I heard. Okay, so doctor, please, is this a seizure? The child is asking. No, it was not seizure. These are the drawbacks of metoclopramide, and is it transient, and already we have received the antidote for that. So what will you do for me? You are doing fine now. I want to reassure you. I want to highlight that you need to replace the dose of the lamotrigine that lost with the vomiting in the morning, and we will involve the nerve doctor about that. If he has any other concern or if you want to do any test, we will tell you. Okay. So first of all, that is a oculogyric crisis, which is temporary, already transient. Already you are recovered from this condition because we already give the procyclidine antidote. And we are involving the nerve doctor because at the morning vomiting you lost your dose of lamotrigine. So you need to do that. So doctor, you means the child is asking the doctor, you mean that this attack is not a drawback from lamotrigine? No, lamotrigine don't cause these symptoms, but it is drawbacks can be headache. Lamotrigine drawback is headache or some abdominal pain or diarrhea, but don't cause this attack of oculogyric crisis. So lamotrigine causes side effects, abdominal pain, diarrhea and headache. It is actually drawback of the metoclopramide, which we dealt with by giving you the antidote procyclidine. Oculogyric crisis is the side effect of the metoclopramide in the gastroenteritis and vomiting the GP prescribed, and we already give the procyclidine antidote for that. So according to my seizures, is there any measurement to do not to have any fits? I'm really happy and admire your complaints to your treatment and avoiding trigger that may aggravate. Okay, doctor. I want to confirm you about continue taking your doses at time and wear your bracelet and avoid sleep deprivations, avoid long screen time, also avoid the hungry and the stress, etc. So we'll give that how can he protect against the fits. First of all, she can take her medication properly, maintain the follow-up regularly, and avoid trigger factors like stress, hungry, avoid prolonged time and the screening, and avoid sleep deprivations, and wear the bracelet regularly. Doctor, how long I will have been taking the lamotrigine? So according to nerve doctor, he will decide if you are controlled and symptoms free for 2 years. He will start a gradual down therapy, tapering of the dose in the some types of seizure. So he will decide by follow up with you. So the child is asking, so how long she is take the lamotrigine? We'll tell that it will be decided by the nerve doctor. Nerve doctor will tell you normally after 2 years they tapering or reduce the dose, but full decision is nerve doctor. Can I be pregnant? So the best one to answer will the question is the women doctor and the nerve doctor, but when this time comes you will be using another medication. And about hormonal contraception, it may be affected by anti-epileptic drugs. So the women doctor will discuss with you more about it. So when she is asking about her fertility, is that she can be pregnant or she can be about the contraception pill. Yes, she can be pregnant, and about the contraception pill, sometimes what happen, contraceptive pill affect the doses of anti-epileptic drugs? So best answer will give the women doctor and the nerve doctor. That time they will adjust the dose and discuss with her in this issue. So when she get her license of a driving license, when you are seizure free from 1 year daytime and 2 year night time, only seizure. Okay, so daytime 1 year and 2 time night time free, then she can get the driving license. The summary, trusted website reflect as usual. So this is all about oculogyric crisis communications. The child is on epileptic medicine lamotrigine. She has gastroenteritis and the doctor prescribe her metoclopramide, and side effect the metoclopramide oculogyric crisis is developed and we give the antidote procyclidine. Okay, thank you.